Hi, my name is Lenz. I'm a pediatrician. I'm also an internal medicine doctor known as an internist. I'm also a board certified clinical lipidologist, and also have gotten a certification in plant-based nutrition through Cornell University earlier this year. Today I want to talk to you about diet and how diet can be used as medicine, how you can use it to help control diabetes, help reduce the medications you're on, help treat your high blood pressure, help control your weight, or prevent from developing diabetes or heart disease if you haven't already developed that, and even learn about how you can use diet to help reverse heart disease, in particular even reverse plaque in the arteries that you have if you already have heart disease. When we talk about diet, for many of you, the immediate concern may be, I just want to lose weight. I don't know if I have heart disease, I don't know if I have diabetes, I may not have it, but I just want to lose weight to be healthy. Well, from a losing weight standpoint, there's a lot of different diets that are out there. And when I use the word diet, I don't want you to go on a diet. When you go to Disneyland for a trip, you don't live in Disneyland, you come back after a week or so. When you go on a diet, you go on it, you do it temporarily, and then you live back in your typical American diet that you may already be on, and the weight is gained back. When we look at diets, I will just talk about diets in general. There are different types of diets. Many of you have heard of the low-carb diets, with the Atkins being on the extreme, or a South Beach diet, a paleo type diet. There is even the wheat belly type diet that's out there. There also are diets from many of the companies out there like Weight Watchers or Jenny Craig, Nutrisystem, among those. And there also is going to be the whole foods plant-based diet, and different authors and studies have looked at these and looking at what the effectiveness are of these. When we look at just weight loss as a measure of effectiveness, it turns out that for effectiveness, the really biggest predictor is adherence, especially in the short term. Those who adhere to the diet lose the most weight. Atkins actually has the most weight loss usually. Unfortunately, most of the weight loss, and usually the weight loss peaks about 6 months, usually about a year later, most people have gained their weight back. So when we look at that, again, it's not going on a vacation and then coming back, it's just a change in how you're going to be eating. When we look at one step further besides what helps control what helps control your weight, is what is the most effective way that you can use to help prevent from getting heart disease and diabetes. And we look at that there's only been really one type of diet that's actually been shown to reverse plaque in the arteries. When we look at different types of diet, there's another type, when we classify diets, has to do with counting things, keeping track of points. Some of the commercial systems like Weight Watchers has some good things with it. There will be no points if you have fruit or vegetables. They kind of like to steer you into healthy eating. In a sense, they tax you if you eat certain things that are non-whole foods or plant-based. They also count things that may be actually healthy, counting carbohydrates that are whole grain, for example. You can use some of the online resources like MyFitnessPal or other calorie tracking systems that can help. And that can be helpful, but it's, again, often difficult to follow, and realistically, most of my patients don't want to have to count things, their whole life, and it's hard to stick to. The approach that I like to use in using a whole foods plant-based diet, not only is it shown to reverse diabetes and has been shown to reverse heart disease, but it is one where you actually don't have to count anything. You actually can eat as much as you want, you'll lose weight, your blood sugars will come down. In fact, if you go on this, I encourage you to be watching carefully if you already have diabetes, because your blood sugars will drop. In the first day it may go up slightly because there's more of the carbs, but they tend to be complex carbs. Because the fat's lower, the blood sugar actually comes down, and often within days people already see dramatic drops in their blood sugars of 10, 20, 30 points in their blood sugars. But with this diet, you eat as much as you want. There's no restriction. You don't count things. What you do change is what you're eating. This is a difference. Instead of being a quantitative, you're counting things, it is a qualitative diet. You're looking at what you're eating. When we look at why should you do this, well, if you're looking at reversing heart disease, Dr. Dean Ornish has done a big lifestyle study in the late 80s to 90s which showed that people who already had known severe heart disease actually were able to reverse the amount of plaque in their arteries. They also had dramatic drops in their cholesterol. From about 40% drop in their cholesterol after a year, it did level off to about 20%. Again, in that study, those who were the most adherent to the diet had the biggest weight loss. He did use some lifestyle with that as well. Dr. Esselstyn from the Cleveland Clinic has done a similar study looking at patients. Those were followed very closely, seeing them every 2 to 4 weeks, and over 20 plus years have had no heart events except and also had significantly lower risk of developing cancer as well. Dr. Neil Barnard took patients and put them on a diet, either the American Diabetic Association diet, which, if you may be familiar with, has a lot of carb counting, calorie exchanges, carb exchanges to keep track. And then another group was on the Whole Foods plant-based diet. And they actually had a much bigger loss in weight as well as dropping of blood sugars. Also, the patient satisfaction was much greater in those who were on the Whole Foods plant-based diet because they didn't have to count things. They actually got a chance to eat as much as they wanted. They just restricted it to a Whole Foods plant-based diet. The next step I want to talk about, after hopefully you have gotten a chance to at least be interested in, hey, I want to lose weight. In fact, every patient of mine who does this has lost weight, and they keep it off and they actually really enjoy it. My patients who've been on it, a number of them have said, I wish I would have done this my whole life. There's immediate rewards, like I can't remember the last time I saw my belt buckle without looking in the mirror, to I finally, for the first time in my life, have a sense that I'm in control of my disease, not this having to happen to me. One of my patients saw me and he was referred to me for his high cholesterol. His triglycerides were about 1,000. He had been on all the right medicines, and there was not anything else that we added. I said, in fact, you're on a medicine that we can actually stop. It's kind of a duplication and it isn't adding, but we do need to make a change in your diet. And we talked about lifestyle changes, all the things that I'm going over today with you in the video. He went home and his wife said, so what new medicine did the doctor put you on? And he said, well, interestingly, he actually took me off of medicine, and he said, I need to make a lifestyle change. He went on a Whole Foods plant-based diet. In the first month, he's lost about 7 to 10 pounds. His triglyceride levels went from 1,000 to 500. And this was with not a significant amount of exercise, just with making diet changes. He said, I'm never going to go back to eating the way I was before. So there are long-term benefits that you can't feel. Reversing plaque in the arteries, you won't feel that. In the short term, you're going to have benefits of weight loss. Other many benefits that you may get, maybe if you have sleep apnea, if you're snoring, there will be benefits. If you have erectile dysfunction for a guy, that is actually a marker of underlying plaque in the arteries, and it can often precede a heart event by 10 to 15 years. It is not just a aging process, and that actually has been shown to also benefit from eating a Whole Foods plant-based diet. There also appears to be lower rates of development of certain cancers. One of the big studies in China, called the China study by T.Colin Campbell, he looked at patients who were in China, or people who were in China. He was commissioned by one of the dying, either prime minister of China, to do a survey of what his people were dying from. And they did a meticulous study looking at what they died from, what diseases, and looking at diet. It turned out that those who were eating a traditional low-fat, Whole Foods plant-based diet, heart disease, diabetes, blood pressure was virtually non-existent. There were many types of cancers that were virtually non-existent. Those who in those areas which became much more Western, with much more Western diet, heart disease was becoming common. We know from a lot of studies where people moved from a culture, from a diet like the traditional Asian diet, which is very low-fat, whole foods, plant-based, and come to a Western diet, they assume the rates of heart disease and diabetes and high blood pressure and cancer rates that those who were native to the Western area. So there's a lot of reasons why, there's a lot of evidence why, and health reasons why, but what actually is a whole foods plant-based diet? Well, the next thing I'd like to talk about is what it is, and after that I'd like to go over what are some recipes, how do I do this, and then look at, beyond that, what are the barriers that you might face.